So in 10 years, what's changed? What hasn't changed? I'm looking back and reflecting, and I'm thinking, wow, what's the next 10 years going to bring? You know, our program has been successful by all accounts, the #1 busiest bariatric center in the state, and yet I still feel as we have so much more to do. We service less than 1% of those patients that really need us. And you can imagine that the importance that our program is to the Central Valley. Our mission really is to provide the support to get patients healthier, to solve their diabetes, to make them live longer.
Over the last 10 years, much more of the change is in the research and actually realizing and understanding how the surgery works. It used to be thought that everything was smaller and tighter, harder to eat, less eat, and that's only a very small part of the picture. What we found out with the research long term is all the changes in the gut hormones that change with satiety, fullness, stomach emptying, and that research is just spectacular. Most people think it's just the weight loss, and we look at that more as a side effect. We do the surgery for the metabolic problems like diabetes and cholesterol and blood pressure. And so 85% of our patients leave the hospital off all their diabetic medicine immediately. It's not over time with the weight loss. The numbers for cholesterol and blood pressure as far as reducing or improving those medical issues are similar.
In long-term studies, 20, 25-year studies, the patients who have surgery live longer than those who do not. And I think it's coming to the biggest impact is not necessarily the reduction in cardiovascular disease, it's actually reduction in cancers, reduction in malignancies over a long period of time. And so that again speaks to the fact that we should be getting to patients earlier than later when we can have an impact on their total health for the rest of their lives.
We see these patients ideally for the rest of their life if they keep coming back. And by far the most rewarding thing I've ever done in medicine, and it's once or twice a week somebody says, "Thank you for giving me my life back." How do you beat that?
The reason I sought to get the surgery was to get an extra 10, 20 years in life. I weighed 479 pounds. Yeah, some of the problems that I had were diabetes and high blood pressure, and I was borderline to getting sleep apnea. The way I was headed, I didn't know if I was going to wake up the next day. Who knows how long I would have been around. Immediately after the surgery, I no longer had to take the medication. I feel amazing. I have a lot more energy. I'm able to do the things with my family. And just as simple as going to the park, going for a run. I wasn't able to run since I was in 5th grade. I was always, the person behind, and they had to wait for me to catch up. Now it's the opposite. I have that much more energy and strength to do the things I couldn't do before. People that haven't seen me in 10 years, they just look at me, they're speechless. I went from a size 6X and big and tall to a size 34, 36, and now I can have actually plans for the future and do other stuff that I wasn't able to do. My personal experience with Dr. Higa is he is awesome. I wouldn't trust anybody else with my life. The amount of knowledge that he has and the care for the patients is just amazing. The lifelong relationship with the hospital, the amount of care that they have to offer, I feel like I'm at home. The comfortableness, the staff are amazing. I would tell somebody contemplating bariatric surgery that it basically changed my life. Excuse me.
You become a doctor to help people. It's not about the numbers, it's not about the profit or this and that. It's really about each individual patient. It's you can see it in the nurses, you can feel it in the team, how much effort they put in each individual patient. And I think that is what makes us successful.
The last 10 years have been a fantastic ride with knowledge and advancement of the surgeries. Can't wait to see what happens in the next 10 years.